Hello and welcome to the Maryland Faith Health Network Liaison Training. I am Reverend Dominic A. Smith. I'm Pastoral Outreach Coordinator, and this is
Pam Phillips, the Nurse Navigator at Carroll Hospital Center.
And today we want to talk about training for our liaison. The mission statement of LifeBridge Health is to maintain and improve the health of our community, and that's accomplished through growth, operational excellence, academics and research, and community service. LifeBridge Health is providing the full continuum of care. As you look to our slide, you see we have ambulatory services, urgent care, transportation, acute care, post-acute care, housing, and assisted living. The Maryland Faith Health Network provides communication and support for congregants during their hospital stays and upon returning home. The liaisons form the confidentiality agreement. It's self-explanatory, where the liaisons are agreeing to be a part of this partnership, and the liaison form is a partnership between LifeBridge Health and Maryland Citizens Health Initiative. Congregants forms a registration where a congregant agrees to be a member of the Maryland Faith Health Network. Here we have the Maryland Faith Health Network workflow. And here we have where a patient arrives at the acute care setting, whether it be inpatient ED or inpatient or the emergency department at LifeBridge Health, which is Sinai Hospital, Northwest, or Carroll Hospital Center. The patient is asked or self-identified to be a member of the Maryland Faith Health Network. And the responses are documented, and the workflow is sent to Pam or myself within 4-hour increments through email. And then we are given the opportunity to go and meet with the patient or the congregant to see if they want to contact their liaison to let them know they are in the hospital. Congregants will be identified through their identification card that each one will receive from their house of worship once they sign up to be members of the Maryland Faith Health Network. They are encouraged to carry these cards, but also can let the nursing profession know during registration that they are a member of this network. Responsibilities at LifeBridge Health and with the liaisons. Here we have the LifeBridge Health staff will connect liaisons and patients once the patient is admitted and requests participation in the program. We will provide assistance and link patients with their faith community liaison, and we will be available to respond to questions from the liaison. The liaison, we're asking you to be prayerful and supportive, and to assemble appropriate congregational resources on behalf of the patient while being sensitive to the patient's privacy. And of course, we're asking the liaisons to be proactive. Pam?
So for your safety, we want you to go to the information desk upon arriving to the hospital at Sinai, Northwest, and Carroll Hospital Center. There we want you to confirm the location of the patient, learn if there's any precautions they want you to follow, look for signage on the patient's door prior to entering, follow directions that are on the sign, and if you're not sure, ask for help. So what kind of precautions might you have to follow? We have something called airborne precautions, and they are required to protect you against airborne transmissions of infectious agents. Diseases requiring airborne precautions include, but are not limited to, measles, severe acute respiratory syndromes, or SARS, varicella, which is chickenpox, and Mycobacterium tuberculosis. Another kind of precaution is droplet, and it is for patients that are known to be suspected or to be infected with pathogens that can be transmitted by droplets. The droplet transmission includes contact with the nose, mouth, mucous membranes, or conjunctiva of a susceptible person. Another kind of precaution is contact precautions, and there are procedures that reduce the risk of spreading this infection throughout direct or indirect contact. Transmission occurs with the physical contact of the infected patient or handling of a contaminated object in the affected patient's room. Masks, gowns, and gloves, as well as standard precautions must be used, so read the signs that are posted. Liaisons must sanitize their hands. Basically, it's common sense, but after touching things that many people have touched, like the doorknobs or the stair rails or the elevator buttons, anytime your hands feel dirty, they probably are, after you handle money, when you enter and exit a patient's room, before and after you eat, after you use the bathroom, after you cough or sneeze, and before and after caring for the sick person. And hand sanitizer is available throughout the hospital. There are a number of emergency response codes that you might hear about if you come to the hospital to see the congregant. We have something called a code yellow. It's an emergency or disaster. We have a code red, which is a fire. Code blue is cardiac respiratory arrest. Code purple is security only response. Code gold is a bomb threat. Code orange is hazardous material spill. Code pink is infant or child abduction. Code green is a combative person, and code gray is an elopement. Your role is to follow whatever the staff asks you to do. How do you get assistance for a patient? We ask that you call out for help. You can use the patient's call bell. You can locate a staff person, and we want you to be proactive if you think the patient needs some assistance. The next slide talks about HIPAA and privacy. HIPAA is a Health Insurance Portability and Accountability Act. It is a federal law. Patient Protected Health Information, PHI, is any identifiable information combined with health information such that the identity of a person would be known. And ePHI is the electronic format of the PHI. Some examples of the protected health information or the PHI are your name, address, date of birth, diagnosis, medications, insurance information, your social security or medical record number, any discussions between a patient and a provider, and notes written by a provider or other staff. The importance in dealing with these common issues is in an elevator, any conversations in public places. An elevator is a perfect place where you might overhear some information being shared. Tracking boards or whiteboards in a patient room, any sign-in sheets, telephone calls, discussion in semi-private rooms, sharing information with family and friends, computer access, social media, text messages, emails, and paper records. So the basic bottom line is what happens at LifeBridge stays at LifeBridge. We want you to make sure that you knock before entering a patient's room. You do dispose of any confidential materials properly. You do keep confidential information covered when in a public area, and you do respect the privacy and dignity of our patients. You don't tell anybody, your friends or your family, about who you see in the hospital during your role of being a liaison. You don't share patient information outside of the hospital without the patient permission. You don't leave sensitive information laying anywhere, and you don't discuss patient issues in a public area. Compliance is not voluntary, it's mandatory. Any violation of confidentiality, a law, regulation, policy, procedure, or code of excellence must be reported to the anonymous compliance hotline for LifeBridge Health at 1-844-732-6233. So if Reverend Dominic and I violate this, we must call this number. So who do we call, or who do you call, if you have an issue that arises? For Sinai and Northwest, you're going to contact the Reverend Dominic Smith. He's the Pastoral Outreach Coordinator at 410-601-8565. He also has an email address, domsmith@lifebridgehealth.org. For Carol, you're going to contact me, Pam Phillips. I'm an RN Health Navigator at 410-871-7129, and my email is pphillips@carrollhospitalcenter.org.
our communication and marketing, information that we're spreading around our hospitals and also in the community. It talks about the Maryland Faith Health Network. It identifies or defines what the network is and how people can help within the hospital and around the community to inform others of it. Okay, thank you for your participation in the Maryland Faith Health Network. We appreciate your willingness to work with fellow congregants to help them in their hour of need when they have a stay at one of our hospitals. This is a partnership of the Maryland Citizens Health Initiative and LifeBridge Health. We are a unique hospital in which we're able to reach citizens or patients or congregants both, not really both, but in Baltimore City, Baltimore County, and as well as Carroll County. Again, we thank you for your participation and we look forward to working with you in the future.